Hello, I'm Dr. Park Minsu. Today, I'd like to talk about the patients I see the most at our hospital. It's diabetes. That's why I'd like to talk about the 8 traits of people with acute body aging due to diabetes who have no family history. I don't think diabetes is simply a disease where your blood sugar goes up, your blood vessels get worse, and you can't control your blood sugar, and you have a lot of side effects. I think of diabetes as a rapid aging disease that rapidly ages the body. There are 2 main reasons. Our cells starve to death because they can't get the energy, sugar, and sugar they need into their cells. So we think it's a disease that promotes rapid cell aging, which is atrophied cells. Secondly, excessive blood sugar and insulin in the body is highly inflammatory. So diabetes is what makes our body more susceptible to chronic inflammation. In other words, because of lack of energy and inflammation in our body, we can't help aging rapidly, and diabetes is now the biggest threat to our healthy life in the 100-year-old age. But there are people who suddenly develop diabetes. When I ask them why, they didn't care. They say, "Doctor, I didn't think I'd get diabetes because I don't have a family history of diabetes." Diabetes does run in our family, but there are many more people who don't have that in their family. Some people get diabetes because they have a family history of diabetes. But a lot more people don't get diabetes, and a lot of people who don't have a family history of diabetes get diabetes. Even if you have a family history, there's a high chance you won't get diabetes, so you don't need to be disappointed. On the contrary, because you don't have a family history, you shouldn't think that you won't get diabetes. Let's find out the characteristics of people who develop diabetes without a family history. First, you all know they're obese. So when you first get diabetes, you're usually obese. But as diabetes progresses, you're drained of energy. You can't make energy. Fat cells are the biggest stores of sugar. The liver, muscle, and fat cells are where insulin stores glucose. So the fat cells can get 300 times bigger. But when they get bigger than a certain amount, they release an inflammatory ruler. The inflammation factor attacks the beta cells in the pancreas, lowers the ability to make insulin. And that's the main reason why the insulin that comes out of the pancreas stops working. If you look at people who are developing secondary diabetes, you'll find that people who get good sleep for 5 to 4 hours a day, and people who don't get good sleep at all. If you don't get good sleep, you're going to lose temporary function. And if I stay up all night like this, I'll probably end up eating late-night snacks or doing a lot of things that bother my insulin. This lack of sleep time or deep sleep is one of the most important causes of lowering insulin function in the body. Third, who gets diabetes? If you look closely, people who lack muscles get diabetes. Muscle is the purest, most harmless way to store blood sugar. We can't extend the liver. Modern people do things that put pressure on their liver. If you add glucose to your liver, it becomes fatty and causes problems in your body. If fat cells multiply, it causes sequelae. So it's very important to increase muscle mass, which we can do as we please. Muscles are especially important because once you become diabetic, you lose muscle exponentially, and your diabetes gets worse. If you ask me for advice on the only way to prevent diabetes, I want to tell you to increase your muscle volume. Fourth, you might be surprised. People who develop a lot of diabetes, people who have a bad gut, people who have an unbalanced microbiome in their gut, people who have SIBO, small bowel hyperplasia, intestinal leak syndrome. If the microbiome is out of balance in the intestine, that means there are more bad bacteria than good bacteria, and more bad bacteria means more obesity, which means a huge increase in carbohydrate absorption. And your intestine's ability to absorb nutrients decreases, so you're malnourished. When we're malnourished, our bodies are trying to eat nutritious food that's high in calories. As his intestines deteriorate, obesity increases, and his selective permutation decreases, his nutritional intake decreases. So it's a perfect storm. If we have a bad intestine, we get inflammation through leaks in our intestines. You get inflammation, you lose muscle, you lose hormone function. The world of sleep is not good. In a way, intestines are the most important organ in our body that regulates inflammation. Fifth, I think you all know this. They're stressed out. The stress hormone is the opposite of the insulin hormone's rivalry. The two hormones are made from the same ingredients. As the stress hormone increases, it attacks the insulin hormone and increases resistance to the insulin hormone. It decreases insulin function. And if you're under a lot of stress, what do you get as a reward? Your craving for sweet food increases quickly by releasing endorphins or dopamine. 6. It's an important part of your lifestyle. If you control this, you can almost prevent diabetes. It's people who don't have a good diet. What causes diabetes is people who eat fast. If you eat fast, you eat a lot, and your insulin can be overworked. If you eat fast, you don't have leptin hormone, so you don't feel full, so you're always hungry. People who feel great when they eat carbohydrates are already addicted to carbohydrates. You need to change your taste buds, and people who enjoy late-night snacks, especially carbohydrates, don't have time to rest because of the insulin hormone. The insulin hormone has to take time to rest and regenerate, but it doesn't take time to rest. The seventh one is very unfortunate. It's people who don't take blood sugar tests. I recommend you take a blood sugar test every 6 months. If it's once every 6 months, we can find it in advance and control it. It's very important to control diabetes early. If you don't control it early, diabetes will rapidly progress, so please keep that in mind. I've been feeling unwell lately. If you have any suspicious symptoms such as polyuria, frequent urination, polydipsia thirst, or polyphagia increased hunger, you should check them out. The eighth is someone who doesn't take care of their diabetes at all. If your hemoglobin A1C is 5.7 to 5.9, it's manageable and can go back to normal without developing diabetes. But if you don't take care of hemoglobin A1C from 5.8 to 5.9 in the prediabetes stage, the hemoglobin A1C quickly goes up to 6.2 and becomes diabetic for sure. Prediabetes is the golden time to save insulin. If your hemoglobin A1C is over 5.7 and your fasting blood sugar is near 100, you need to start managing your diabetes. If we look at the features on the top, we can see what we need to do to prevent diabetes. First, check your blood sugar regularly. You can have a good health checkup. For those who are prediabetic, you should check your blood sugar more aggressively. Checking your blood sugar is enough to alert us. Second, if you're obese, you need to lose healthy weight. You need to work hard to maintain your weight. You have to try to get 7 hours of sleep a day. And you have to try to reduce your stress. I recommend a stop thinking exercise where you close your eyes and stop thinking. Also, walking without thinking is a great way to relieve stress. And if you work out until you sweat, your stress will decrease dramatically. You need to eat just the right amount of protein. You need to consume 1 gram of protein per kilogram of your body weight. If you weigh 60 kilograms, make sure you consume 60 grams of protein. You need to eat plant proteins balanced with animal proteins. You also need to do weight training. Push-ups, gums-up exercises, and thigh exercises every day. For those of you who don't have knee joints, squatting would be even better. It's very important to maintain muscle tone by walking 7,000 steps a day. You need to pay more attention to your lower body muscles. It's good to exercise somewhere, but it's much more effective to exercise regularly in your living space every day. And if you follow the dietary regimen of lactic acid, bacteria, fibers, and water that are good for your stomach, your body will produce healthy metabolites. This makes your microbiome healthier, and your intestine becomes a strong guardian for your blood sugar. Eat slowly. And remember to eat upside down. Don't eat carbohydrates first, eat vegetables first, then protein, then carbohydrates last. When you enter prediabetes, please be alert and work hard. Prediabetes is not a course that leads to diabetes, but a chance for us to return to normal if we work hard. As I mentioned today, there may be obvious family histories. But more important than family histories is the choice of what kind of healthy lifestyle we want to live. Diabetes is completely preventable if you take care of it. Thank you.